Thank you so much for tuning into the program today. I'm your host, Neal Howard, here on Health Professional Radio. Our guest is Dr. Malaz Boustani. He's joining us today to talk about a couple of services that are available in Indianapolis, Indiana. Dr. Boustani, welcome to Health Professional Radio.
Thank you so much for the invitation, and it's my pleasure and honor to be with you and your audience.
Give our listeners just a bit of background about yourself, and let's talk about these centers in Indianapolis.
Yeah, so I'm a physician, specialized in caring for the wise men and women from our society, those who are 65 and older. Mm-hmm. And within that group, I promise that I will take care of their brain health. So a geriatrician and neuroscientist with one simple vision of transforming brain health for all, not tomorrow, yesterday.
So are we talking about as they progress in life, maybe eliminating or avoiding Alzheimer's, dementia, and some of the other things that go on with the brain as a result of aging?
Yeah, I'm trying to do two things. If you already suffer or live with Alzheimer's disease and other related dementia, then I want to make sure that I can optimize your quality of life and your loved one quality of life. And if you don't have Alzheimer's disease related dementia, you are not living with the disease yet, then I work with you and your family to reduce your risk for developing Alzheimer's disease in the future.
So this is all happening at the Eskenazi Center for Brain Care?
Yeah, we have been able to really concentrate and cluster all of the intellectual capital in brain health and brain care into the Sandra Eskenazi Center for Brain Care Innovation. In our center, if you come over, we have been able to break down the wall that separate the research and the scientific inquiry and the care delivery. So we are trying to make sure the minute we pick up a signal that is good for your brain health, that we can offer it next door, all right, in next day immediately. Mm-hmm. So that's one wall we dropped and broke down and eliminated at Sandra Eskenazi Center for Brain Care Innovation. The other wall is we are really looking at Alzheimer's disease-related disorder as a disease that affects the person who is living with the disease, including the patient himself or herself, but also the other family member who also live with the disease. Maybe they don't suffer from the disease, but they live with it. They struggle from the disease. So what we have done at the Sandra Eskenazi Center for Brain Care Innovation is we really changed the name of the patient and become more inclusive. So we are taking care of the patient and their entire family. We coach them. We provide services for them, recommendation for them, not just one time, but also during their entire journey living with this disorder in the clinic and outside the clinic.
What type of criteria does a family or a patient have to meet in order to be considered at the Sandra Eskenazi Center for Brain Care Innovation? Is it simply being of age, or does their disease have to be in an advanced or early stage? Yeah,
so, we are switching the power. Instead of the doctors and the nurses determining who they're going to serve, we do the opposite. So anybody who living in Indianapolis and Indiana, and sometimes we get actually people from all over the country who have questions about their brain health. They might be suffering from Alzheimer's disease or living with Alzheimer's disease and other related dementia, or they have concern about their own risk and how can they mitigate that risk. Doesn't matter their age. Primarily, we're looking for people who are 50 and older. They can come over, they can seek our help, and then we provide brain care services to them and provide brain care plan for them. And we work with them on executing the brain care plan and make sure the brain care plan meet their actual need and their own goal.
Now let's talk about the Richard M. Fairbanks Burn Center.
That is one of the major center of excellence that exists in Eskenazi and serving not just the Marion County in Indianapolis, but it's really a hub for providing state-of-the-art burn care to the entire state. It's run obviously by surgeons and amazing team in the hospital who take care of you during your burn experience and accidents and make sure they save your life. And then they don't stop there. They make sure after succeeding and saving your life that they can work with you until you feel comfortable going back and optimize the quality of your life.
Is there as much hands-on assistance with the family members who may be taking care of a burn victim with the burn center as there is with the brain center?
This is one of the really the hallmark of Eskenazi Health and under the leadership of Lisa Harris and Matt Goodwin. They break down the walls. So they provide care for the entire community, starting in the home of the person who suffer from the disease, live with the disease, and their family. So this signature that we are using in the Center for Brain Care Innovation, Sandra Eskenazi Center for Brain Care Innovation, it's really throughout, it's integrated and embedded throughout the medical services within Eskenazi Health.
Now, in wrapping up, Doctor, where can we go online and get some more information about Eskenazi Health?
Unbelievably, just simply ask Siri or Alexa and tell them to connect you with Eskenazi Health, www.eskenazihealth.edu, and you'll get into our portal. And from there, you have a very well-navigated website that makes sure we serve your need and make sure we triage you and send you to the right place to maximize your quality of life.
Great. Doctor, it's been a pleasure. Thank you so much for joining us today. Dr. Malaz Boustani, talking about two services that are available through Eskenazi Health, the Richard M. Fairbanks Burn Center, one of only 63 burn centers in the United States that is verified by the American College of Surgeons and the American Burn Association, and the Sandra Eskenazi Center for Brain Care Innovation, the first center of its kind here in the United States to combine pioneering research and clinical care, yielding much faster and more effective outcomes for the patient and the caregiver alike. Thank you so much, Doctor. I'm hoping you'll return and speak with us in the future.
Anytime. Thank you so much for your service.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of the program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page when you visit us at hpr.fm and healthprofessionalradio.com.au.